Okay, today is Monday, May the 16th, and I'm Anthony Quinn, the Chief Community Officer at CARP, also the Ontario election lead for this campaign. And I'm pleased to be joined by the leader of the Ontario Party, Mr. Derek Sloan. Welcome, Derek. Thank you for joining us.
Thank you for having me, Anthony. Glad to be here.
Many will recognize Mr. Sloan from his role as a former member of federal parliament representing Hastings, Lennox, Addison. Addington, pardon me, Derek, where is that in our province?
Yeah, so Hastings, Lennox, and Addington is basically sort of Belleville to Kingston and all the way up north, close to Algonquin Park. It doesn't include Kingston, but to kind of right up to the border of that area there on the 401 corridor going east of Toronto.
All right, so many of our members will know you from your representation of them, and then you ran as a candidate for the leadership of the federal Conservative Party. So you made a more of a national presence for yourself. Tell us a bit about the history there.
Yeah, so I was a federal Conservative member of Parliament. I actually ran for leadership of the Conservative Party in the race that began in 2020 and ultimately elected Erin O'Toole as leader of the party. So I was traveling around as much as we could during that time. There were some restrictions, but did travel to many different provinces and was able to meet with many people in person.
So federal representation, now you're looking to represent Ontarians specifically. Tell me about your move from federal politics to provincial interests.
Yes, that's correct. So in the last election, I was not reelected as a member of Parliament. I was sitting as an independent at that time. I've always been interested in rejuvenating Ontario or Canadian politics, and sometimes that can be done at the federal level, but we also need to rejuvenate politics provincially as well. And there was a good fit for me to lead a party here in Ontario called the Ontario Party, and I thought it was good timing for me, and we were able to get a great slew of candidates to help represent the party as well. So very glad to be doing this and excited to see what happens.
And you do have one current or just sitting member from your party, Rick Nichols. He became a member of your party while he was still sitting as a member of provincial parliament.
That's correct. So Rick Nichols represents Chatham, Kent, Leamington, and he is our sitting member in the Ontario legislature right now.
And he's running for re-election as well.
That is correct. Yeah.
All right. Well, thanks very much for that background. I wanted to let you know that CARP is encouraging every one of our members to speak to candidates from all parties, but to really hold their vote tight to their chest. And we believe that the CARP 5 issues that we'll talk about today are really bread and butter issues that every party should be able to figure out a way to respond via their own particular route. But each of these issues, we believe, can be completely nonpartisan. So I'm going to ask you to tell us a bit about the Ontario Party's platform as it deals with issues specific to older adults in Ontario. Is that the bird or the children?
Yeah, we got a wild crew of kids running around here. I apologize for that, but.
So a bit about your party's platform specific to older adults, and we'll talk about the CARP 5 as well.
Yes, exactly. So so our party has a variety of policies that, of course, intersect with various age groups, but specifically with respect to elder Ontarians, there is, as we all know, a deficit in the healthcare system and a deficit in the long-term care system as well. And much of, or a lot of my advocacy as a member of Parliament was, in fact, on what I found to be deficits in our federal and provincial government's response to COVID-19. And one of the critiques that I had is that they did not adequately protect seniors well enough. And of course, we all know some of the horror stories. We had sick residents of long-term care who had COVID-19 put in rooms with people who didn't have it. We had workers working at multiple different homes and sort of spreading the virus to and fro. There's lots of things to say about that. We want to make sure that we are protecting the most vulnerable. And, from our opinion, what the government did was sort of blanket approaches to dealing with the virus. But we knew very early on that the elderly were in most cases the most impacted by COVID-19. So we do need to rejuvenate the long-term care system. Our party generally has an approach where we like to move away as much as possible from funding sort of an institution to funding a person. And so we have a similar program for primary education, but we also have an idea to do that more in the long-term care aspect as well. So, there's some, there isn't a one-size-fits-all approach for every person. Some people prefer to age in their home. Some people have other needs that they need, other needs that might necessitate being in more of a group setting. We want to, as much as possible, provide funding to a person so that they can sort of decide what it is they want to do with it. So we do, I know we're going to be talking about this more, in detail later, but we certainly, are in favor of some of the more, personalized approaches to long-term care, whether it be aging at home or whether it be in a long-term care facility. And we believe fundamentally that, doing things differently and not one size fits all is the best way to get things done. And so, a lot of the new ideas that we're seeing where we're long-term care homes are becoming more personalized and there's different options, as well as extended home care options. These are things that we approve of and would seek to, provide more funding and provide more choice for residents as well.
Well, thanks very much. If we can dig into the CARP 5 issues, and you've touched on a number of them there. The first one, but not necessarily in any order, I want to talk about funding better home care. So you mentioned personalized care. 96% of CARP members tell us they would prefer to age at home and not necessarily the single family home they live in now, but down the road, wherever that is, they want to be in a home of their choice and have the care provided in their homes that they require. Right now, it's estimated Canada has a shortfall of 30,000 PSWs over the next 5 years. And the issue has been added to by the PSWs being called to work in long-term care facilities where they're getting a little extra pay, and the care needs are not being met in the home today. It's less than 5 out of 10 calls for PSW service are actually being able to be provided by the publicly provided PSWs today. So would your government commit to hiring the required number of PSWs, finding and training and retaining them so that Ontarians could live that life in their homes as they choose to?
Yeah, and I really appreciated your write up on this on your website, because you make it very clear that the cost for home care is actually much more affordable than long-term care, and much more affordable than hospital care. So I think it makes sense. Obviously, it allows people to live with dignity and to live their remaining years as they choose. The way that we feel that we can get there, we have a great education policy at the sort of post-secondary level, where we really want to target funding towards careers that have, the job demand that's there. And so obviously PSWs and other healthcare professionals are at the top of that list. And we want to make sure that we're providing the funding so it's very easy to streamline people into these careers. Another issue, of course, is international equivalency. And we have an issue in this country where, people will, based on their education, they'll be qualified to come to Canada, but then they won't be able to use that education here in Canada. So I think we do need to do more to make sure that people who have, reasonable foreign training, as a PSW or as a nurse, are able to get qualified to be nurses and PSWs here. So that's another issue that, again, is under provincial jurisdiction, and we want to make sure that we tackle that.
Now, CARP as an association advocates for our members, and there are other groups representing the labor side of the equation who would argue for increased rates, for protections and full-time jobs with benefits for these home care workers. Now, that's perhaps not CARP's role to advocate for the workers, but how do we ensure that we can create a work-life balance that will attract those care workers we need, and it not be a minimum level of pay that doesn't attract the workers that we need?
Yeah, so there's different ways to look at that. I mean, one is to mandate a certain number of PSWs, per resident, which would require nursing homes to, to hire more people. And if that means they have to offer them more, lucrative pay packages and benefits, then so be it. Our party has talked about different ways to ensure that we have more personalized care. And one of the major issues in our mind that occurred during the pandemic is that you had, because of sort of the piecemeal nature of a lot of this employment, you had people working in multiple homes at the same time. So I think that we want to require more full-time jobs for PSWs. I don't think it makes sense to necessarily say that every single position all the time must be full-time, but we certainly have to look at incentives to keep people, working more at one home, because I think when we're seeing, the multiplication of people working at multiple homes, and there could be, one person could interact with 3 staff that are working at 4 different homes apiece, it really, exponentially creates risk for people in vulnerable settings. So I do think that more full-time options and requiring that for nursing homes and their staff actually solves a lot of problems just with that one solution.
That will help address the issues in the long-term care institutions themselves, but not necessarily for the home care workers who, so by design of that job, would be moving from individuals home to home to meet their care needs. But there are solutions to be found when you may have one PSW visiting a what they call a NORC, a naturally occurring retirement community, where there may be a dozen potential clients of that PSW in that home, and actually focusing them all in one home instead of sending that person to another resident across town while someone else comes into that home. So I think there's some efficiencies to be found there. But let's move on to that issue of long-term care. Now, CARP's advocacy on this during the election is not specific to the amount of beds or the wait lists that we know are a big issue with long-term care now and planning to the future. But we're talking about a transformation in the model of delivery of care. We call it emotion-based care, and it looks at the resident as an individual person. You had mentioned the need for individualized care, and takes away the task-based checkbox, dressed, fed, put in front of the TV on to the next resident. So we're looking for a real transformation in how we care for our most vulnerable in these long-term care homes. And we're looking for commitments from candidates to say, yes, I see the value in that. I see the need to make those changes, and I will commit to doing so.
Yeah, so I really liked your position on this, and I agree with you. There are some great examples in Canada and other countries of sort of this transformation that you're talking about, and I think we really do have to make the experience for people in long-term care homes less institutional and more home-like, whether it be just simply the color of paint on the walls, but also the experiences that they have, and it really does need to feel more like a home setting. And I think that your rationale for wanting that is a sound one. And the Ontario Party would commit to requiring nursing homes and long-term care homes to change along the lines of that model.
Thanks very much. CARP members really are laser focused on healthcare during this election, and you'll see that each of the CARP 5 surround that healthcare envelope. You were in the federal government and dealt with the needs of the provinces when it came to the healthcare envelopes, but there seems to have been an ongoing battle between the provinces and the federal government, each blaming one another, either for not using the funds that have been allocated from the feds to the provinces, or the provinces claiming they haven't received enough. But either way, in Ontario right now, we have a continuing crisis in our care, and specifically in wait times for care. A limited number of resources and a growing demand. How would the Ontario Party respond to the ongoing need in Ontario's healthcare system when it comes to shortages of nurses, family doctors, hallway medicine, ER wait times, delays to see specialists, delays in diagnostics? The one thing I'll add is Canada is spending at the top of the OECD countries, and we're getting results near the bottom of that list. So how would your party respond to that? I think I would call it a crisis in Ontario's healthcare system.
Yeah, yeah. So that's you've outlined it very well, and of course it's a complicated problem. At the at the very beginning, I don't like this sort of passing of the buck. I believe in principle that provinces should have the tax room to be able to fund, to be able to tax for their own jurisdiction. So I don't like the idea in principle that the government is raising taxes and then transferring to the provinces, and then it gives both of them the ability to blame the other as to failures to the system. So from a structural level, and again, this is not something that I can promise myself, it would require a federal change as well. But I believe in opening up tax points at the federal level to allow provinces the room to be able to, tax and raise money for their own competencies. So, for example, healthcare is what we're talking about right now. So that's a structural issue that allows for passing the buck frequently. The other issue that we're seeing here, and there's many, and I've mentioned some things that would be helpful. I mean, obviously, if we went to more of a kind of a better home care model, that obviously relieves some pressure on the system. If we work to increase international equivalencies, we can get some people who are already trained into the workforce. When you mentioned the OECD spending and our high spend versus poor outcome, we strongly believe, and this, unfortunately, this has become controversial in Canada, but one of the things that all of those other countries do that rank higher than we do is they actually spend more things are covered. So all of these countries that rank higher than us, they have a lot more dental coverage and other coverage that we don't have. But what they also have is they have private delivery options for many different services, and they have the ability for supplemental private insurance. So we believe that to move in the direction of some of these, best practice countries in Europe, we have to do what they're doing. And that means allowing for more private delivery of certain things, diagnostics, testing, and allowing supplemental health insurance for those who want it or can afford it to take some, strain up the system. So that is, again, unfortunately controversial to discuss in this province, but that's what these countries are doing. And we feel, frankly, that of course we need to have a universal system that can provide care, but there's ways to deliver that care in a way that is more efficient. As far as actually increasing the capacity of the healthcare system, anecdotally, I know many people who are unable to get into medical school, for example, in this country, and they're studying. In my extended circle of contacts, I know about 7 people who are studying medicine. They're Canadian citizens studying medicine in Ireland or the Caribbean, and ultimately they're going to be working somewhere other than Canada. So we have a plan here in Ontario to open up more spots in medical schools so we can get the specialists that we need. And again, we subsidize education here in this province. We want to make sure that we're not subsidizing doctors to go and move somewhere else. So we want to have a commitment from our students to be practicing in this province for a period of time. That's a sort of a brief overview. I know it's a complex issue, but I'd be happy to talk about it more.
Yeah, it is. Thanks. And just on that issue of not being able to discuss the different funding options, the user options in privately run clinics, for example, that becomes very polarizing when trying to find responses. There's 3 authors, I believe, in the Globe and Mail who released a series today talking about responding to those healthcare issues and not moving away from a universal model, but different models of delivery. How can Canadians and Ontarians in this election have a frank discussion about what we need versus how we achieve it?
Well, I think that almost everybody, when talking about our healthcare system, says that it needs to be drastically different. And if anybody created the system today, we wouldn't look like what we have. But at the same time, there's this idea that if we change anything at all, we're somehow denying our Canadian identity or doing away with something that we're proud of. I think that we have to always realize that there's better ways to do things. And honestly, I mean, I've seen some polls that show that the majority of Canadians are open to some of the things that I'm talking about, just because the lack of results that we're seeing. I was knocking at a door yesterday where the gentleman was telling me that him and his wife are, I think, on their 8th month of waiting for some, kind of diagnostic procedure. This is something that is just unacceptable. And I think we have to look at every option. And, there are countries, like you said, that are performing better than us. And I think we need to start there to see about different ways to deliver healthcare in this province.
And if it took turning the system over or up on its head, is the Ontario Party willing to make that change? Because we've had these discussions for decades now. They get kicked down the road, and we end up in these phases of crisis like we had during the pandemic. So would the Ontario Party make the tough decisions to achieve the goals that I think all Ontarians have?
Yeah, I mean, frankly, we have to. And, there's no more, we don't have any more time to kick the can down the road. Our party is known for its, uncompromising stances on many issues, some of which are controversial, but it is a must for leadership. And unfortunately, we see, again, kicking the can down the road, sort of assuaging, special interests and things like this. But unfortunately, we need to see a drastic rethink. I think any government needs to move slowly and carefully, but we definitely need a drastic rethink, and we need a government that's willing to follow through on that. And our party would. I understand that it's easy for me to just say those words, but I hope that our reputation as a party precedes us in terms of being willing to stake out claims on issues that are potentially controversial.
Good. Well, that might move us to the next item on the CARP 5, and that's uh, prevention and CARP advocating for governments to be active in helping older adults prevent negative health outcomes. And vaccinations are one way that older Ontarians can really prevent some of the things like influenza, shingles, pneumonia, and now COVID-19 that can really befall them. You and your party have had a number of public debates around vaccination mandates, but are you a party that is willing to fund vaccinations for older adults so that they can prevent the big three, influenza, pneumonia, and shingles?
Yeah, I'm glad that you raised that issue. Much of what we've argued for, whether it be about vaccination or other treatments that are available, is that we want to make sure that people have the choice, the personal choice about what kind of treatments they think are best for them, and have the ability to take advantage of them. So in the context of vaccines or other preventative healthcare treatments, we want to make sure that Ontarians have those options. And I think that, one of the things that one of the issues that we took in terms of the mandates and aside from the mandates, the lack of ability to access other options that were available in other countries was frankly a lack of choice. And so we want to make sure that, elder Ontarians, but also all Ontarians have access to medical treatment and medical options that they choose to have. And I think that's important to have in society. And I liked how you mentioned prevention. And I know that there's another CARP 5 that deals with exercise and things like this. But I feel that in our healthcare system, again, it's far more often sick care than it is healthcare. And there's lots of, lifestyle medicine is a burgeoning career that basically is predicated on lifestyle practices that can reduce the odds of some of these, big killers that are out there. So we need to make sure that we're focusing on healthcare as well as sick care, because an ounce of prevention is worth a pound of cure. And I think we could do a lot better in that sphere.
Yeah, we share that opinion that an ounce of prevention is worth a pound of cure, but that prevention takes investment by provincial governments. So something like the shingles vaccination, the latest version, I think it's called Shingrix, offers now a 90% efficacy, but it would take and takes a provincial body the investment and ordering it and having it in stock. Otherwise, even if you wanted the choice, it wouldn't be available to you. So the provincial government as a funder would have to work with the pharmaceutical companies to ensure they were getting the best in class vaccinations, to ensure they were available to Ontarians, that they were easy to procure. I'll give you my own personal anecdote. My dad is 80 years old. His family doctor recommended that he get the pneumonia shot. That So that was one OHIP appointment for my dad to get that recommendation and prescription. Then I took that prescription to the pharmacist, waited for it to arrive, made a second appointment with my dad's family doctor to pick up the prescription, pick up my dad, and have that cold chain right back to the doctor's office so the doctor could inject my dad with his pneumonia shot. So obviously not an efficient use of sparse healthcare dollars, and the out-of-pocket cost for the pneumonia had to be paid by my father. So vaccine policy, we believe, is important in prevention, but also making it accessible and not an out-of-pocket expense for CARP members, for seniors in Ontario. And I'll say again, because we have a universal healthcare system, older adults believe, and this is what we've heard from our members in polling, that if the government isn't paying for it, then it's something that's nice to have, but not something that they really would benefit from. So something like universal influenza program, universal shingles program, universal pneumonia programs would send the right message to older adults that these things are there for them. So would you commit to that sort of funding for these vaccines for older adults, if they choose to take them, that is?
Yes, yes. So I think, I mean, you mentioned, the efficacy of some of these treatments. I think that any critical treatment that, again, is efficacious and is targeting a very real issue in the elder community should basically be free of charge or reduced in charge. So yes, in principle, that's something we agree with.
Terrific. And then the last one of our CARP 5, again, not in a particular order, but just the way that we've laid them out, is another preventative model, and that's funding fitness for older adults. Older adults, one of their largest concerns is outliving their money, and they may tend to avoid investing in things that are nice to have, like fitness. And we know that the healthcare savings, the knock-on healthcare savings of having an older adult who remains physically active are tremendous, far more than the dollars that the government might return in a tax refund. So CARP is advocating for a $100 per month or $1,200 per year refundable tax credit that would see them engage in activities that would promote their physical fitness, extend their health, and hopefully cut down the eventual healthcare dollars. So would you and your government support something like a refundable tax credit for seniors fitness, and concurrently with that, encourage municipalities and service providers to focus on that aging demographic, this massive demographic of baby boomers who are not being serviced in the marketplace for fitness programs that meet their needs?
Yeah, I mean, I think that's a good idea. That specific idea is not something that my party has discussed yet. In fact, I just learned of it today as we were preparing for this interview. But I think things like that are really good ideas. I do like in a lot of municipalities, you're starting to see little, sort of outdoor exercise, little parks, but they're not for kids, they're for adults, and they're just along trails and so on in municipalities. So I think the more that we make exercise options available, readily available to people, and low cost or free, I think these are good ideas. So I think your idea is a good one, and there's probably others that would work as well to make exercise more available to our seniors.
Growing up in Ontario, I was part of the participation program and other things focused on youth physical fitness. We know that a lifetime of fitness can have a lifetime of rewards, but we know the immediate impact that a return to physical fitness can have for older adults and reducing comorbidities. So we hope that the Ontario Party would dig even further into this issue and see the return on that investment from a fiscally conservative point of view, that this type of preventative investment would pay off in the long run in hospital care costs.
Yes, no, I absolutely believe that. And I think exercise is one of the most important things that people can do to improve their health and improve the likelihood of, the major killers that are prevalent in our society.
Okay. Well, thanks very much for that, Derek. If you have time for one or two more points and just some quick hits on dental care, the current Ontario dental care program for seniors has a lot is lacking a lot. It was put on the public health service. Those who qualified couldn't visit the dentist of their choice, but had to get in line with the public health dentist, and many of the regions actually didn't put the program into place. How would the Ontario Party deal with the needs for low-income seniors in dental care?
Yeah, no, so I think that's a very critical issue. And again, I feel that choice is a very important principle. So as much as possible, we want to enable seniors to be able to access the dentist of their choice. And I think that we can move in that direction. I mean, there may be a situation where the coverage, the particular dentist is charging more than what the coverage is, but we want to make sure we're providing coverage that is reasonable and at current market rates, and not at reduced rates.
And what about specific for seniors who considered low income and would qualify for the current Ontario program, yet end up in long queues that see them in the emergency room prior to seeing a dentist?
Yeah, well, that's inefficient. I mean, we need to make sure that that people are seeing a dentist early. I mean, and again, prevention in dentistry is as important as it is in anything else. So we need to make sure that low-income seniors are able to get in and see dentists, in a timely fashion, and not just when their teeth are hurting, to get the cleanings and things that can keep them healthy as well. So this is something that's important, and our party would make sure that that system is fixed.
And just a few months ago, Ontarians can remember being denied service by their optometrists if they were over age 65, or if you had a child who was in need of optometry care, they were denied service because of a dispute with the provincial funder. How would the Ontario Party deal with resolving, I believe, the ongoing dispute between Ontario's optometrists and the provincial government as funder?
Yeah, well, I mean, that's something that we obviously have to get to the bottom of and make sure that is dealt with. Obviously, seniors are typically in need of more optometry care and ophthalmology than the younger age bracket. So it's something that we need to make sure is available. And so our party would seek to resolve that. And, I think obviously it's these kinds of things need to be resolved quickly, because again, healthcare that's not treated when it needs to be can spiral into other issues that again burden the system in ways that it need not.
During the dispute, our members weren't necessarily picking sides between the funder and the provider. They just knew that they couldn't get in for the healthcare, the visual healthcare that they needed. So that's their biggest concern is access. And I think they're calling on both parties to come to a resolution, but not be held hostage in the labor negotiations between the two parties.
Yes, I understand that.
Well, Derek, I think you've been very generous with your time. How can Ontario voters find out more about your party, about their local candidates, and your parting messages for us as we're about 13 days from Election Day?
Yeah, so I would say that, the mainstream, most people that I talk to feel that Ontario could be a better place to live and work and age. And so to them, I say, you probably shouldn't vote for one of the parties that got us into some of the problems that we're facing right now. So for people that want a different option that has some, good ideas, I would suggest checking out the Ontario Party. They can go to our website, which is www.ontarioparty.ca. They can see what we stand for there. And, I, like many Ontarians, feel that it's time for a change. And you're not going to get change by voting for one of the governments that's been running this province for the last, 100 years or so. So it's time for change, in my view. And we're a good option for that.
And how many candidates are you fielding in this election?
We have 105 candidates in many ridings around the province. That's nearly a full slate. So chances are in the riding that your listeners are in, there's probably an Ontario Party candidate that's there.
Great. Derek Sloan, leader of the Ontario Party. Thank you very much for joining us at CARP, and good luck in your election.
Glad to be here. Thank you so much.
Thank you.